a bill for an act to protect the right of Australians to make their own health decisions in relation to COVID vaccination and for related purposes.
The member for Hughes.
I move that this bill be now read a second time. Mr Speaker, the principle behind this bill is quite simple. COVID vaccinations in this country should be freely available to all, with informed consent, of course, but they should be mandatory to nobody. Already, Mr Speaker, there are 16 US states that have introduced similar legislation to that I introduced today. This bill has been modelled on that of Florida's bill introduced by Governor DeSantis, which has been widely accepted by the Florida electorate, Deputy Speaker. And I hope that this parliament will move forward and bring this bill on for a vote and a debate as soon as possible. Deputy Speaker, this is simply about the type of country that we want. Do we want a country where government officials and petty bureaucrats demand that you show your papers, that you show your medical papers? I say that is not the country that I want. Your medical records should be privately something between you and your doctor. And, Mr Speaker, the entire concept of a vaccine passport by itself is inherently misleading. There is little evidence to show that this novel experimental COVID genetic vaccines actually prevents someone from contracting COVID, or that it prevents someone from spreading COVID, or it prevents someone from being hospitalised with COVID. The latest data for the education of the member at the desk, the latest data, Deputy Speaker, from the US on what they call vaccine breakthrough cases. And these are cases where someone has been injected twice and after a period of 14 days they still contract COVID. The number is so many that they no longer count them, but they do count the number of hospitalisations. As at the 14th of June, the number of so-called breakthrough cases, that is people that have been vaccinated twice and have ended up in hospital with COVID, stands at 2,622, and the number of deaths of people that have been vaccinated twice in the US and have passed away from COVID stands at 549. However, these numbers, Deputy Speaker, the CDC says, and I quote, are likely to be an undercount of all SARS infections among so-called fully vaccinated persons. This surveillance relies upon passive and voluntary reporting. So we don't actually know what the true number of breakthrough cases are. Deputy Speaker, there is also a growing concern over vaccine safety. The highly respected and highly credentialed Dr. Tess Lawrie, PhD, has recently stated, and I quote directly from a submission that she made. She said, quote, "There are more than enough evidence to declare that the COVID vaccines are unsafe for use in humans." Deputy Speaker, this is also a great concern, as we also have, Deputy Speaker, data from VAERS in the USA, which shows, as at the 4th of June, that there have been 5,888 deaths that have occurred in people after the vaccine. Now, it is true, Deputy Speaker, that this VAERS data is questionable. In fact, Dr. Peter McCullough suggests the number is more like 50,000 deaths rather than 5,888. But the fact is, Deputy Speaker, we just do not know. Again, this VAERS data is based upon voluntary reporting. So we simply have no idea about what the true rate of deaths are after COVID injections, and we have no idea whether they were related to them or just a mere coincidence. And I say, Mr Speaker, that is the entire problem, because we have to admit this is still one giant medical experiment. And in that, Deputy Speaker, I would like to quote Dr. Damien Wojcik of New Zealand. And he talked about having his patients injected. He said, "Not on my watch, not with my patients. My patients are living persons with names and families, not laboratory rats to be sacrificed in a global experiment." Dr. Roger Hodgkinson said recently, a doctor from Canada, "This experimental vaccine should never have been released. Mass vaccination is so transparently stupid. Medical idiocy of a grotesque degree. The bottom line is that mass vaccination of everybody should stop immediately. And when it comes to injecting this stuff into the arms of children, I call this, quote, state-sanctioned child abuse." Dr. Peter McCullum has recently stated, "I can no longer recommend the vaccines." Deputy Speaker, therefore, as this is our medical experiment, the idea of having a vaccine passport is coercive. It is to coerce people into participating in a medical experiment which we simply do not know what the end result will be. We've even seen here in Australia, Deputy Speaker, how our medical bureaucrats have got it wrong time and time again. Firstly, they said, Deputy Speaker, when it came to the AstraZeneca vaccine, that there was no evidence of a relationship with blood clots. They were dangerously wrong. Then, when it was clear, the data out of Europe, from the European Medicines Agency, that the AstraZeneca should be suspended, and most European countries elected the cut-off date of 60 years of age. So if you're under 60, in most European countries, they did not give you the AstraZeneca vaccine. But our medical bureaucrats, Mr. Speaker, decided that the Europeans didn't know what they were doing, and we would have the cut-off at 50. And only last week they admitted that they were wrong again. And the result of their error has been that 800,000 Australians have been injected with a substance which our Chief Medical Officer now says had a greater risk than any benefit. 800,000 Australians injected where the risk was greater to them than any benefit because of a mistake by our medical bureaucrats. And the thing is, we should look at that risk-benefit analysis. But we have seen, Deputy Speaker, that the short-term risks have been grossly underestimated by health officials around the world. That's why there have been suspensions and recalls. But we have no idea of the medium-term risks, we have no idea of the long-term risks, and we have no idea of the intergenerational risks. Therefore, for anyone to stand up and say that they know that the risks or the benefits outweigh the risks, they simply cannot say that. Because you cannot quantify, as you cannot quantify medium, long-term and intergenerational risks, you simply cannot make that assessment. The data is not there. We are flying blind into this experiment. That is also why we do not need a domestic vaccine passport in this country. It also would be a complete violation of human rights. The UN Economic and Social Council has said, I quote, "The freedoms include the right to control one's health and body, including sexual and reproductive freedom, and the right to be free from interference, such as the right to be free from torture, non-essential medical treatment and experimentation." I'd also like to note, Deputy Speaker, make special mention of our Paralympics squad. We have bureaucrats there running that Paralympic squad that have decided to discriminate against Paralympians. So we have a situation where athletes playing the same sport, going to the same country, in the same city, going at the same Olympic facilities and playing at the same stadiums. If they're a Paralympian, they are forced into this experiment, otherwise they are not picked. If they're in the normal Olympics, that does not apply. That is discrimination. That is contrary, Deputy Speaker, to the principles of this bill, and I would call on the Australian Paralympic squad to end their discrimination against athletes going to the Paralympics. With that, Deputy Speaker, I commend this bill to the House, and I also congratulate my good friend, the member for Dawson, for being a seconder for this bill.
Is the motion seconded? It's okay. No, it hasn't.
Seconded, Mr. Speaker. Thank you for your
Thank the
indulgence.
member for Dawson.